Time now for this week's Health Matters. Paul Critz along with PA Lynn Szabo, and a topic this week that is near and dear to my heart because it's part of living with my wife, kidney disease.
Right. Thanks for the suggestion. But kidney disease is kind of like the forgotten child.
How so?
Because kidneys sometimes go out with a bang, but mostly it's a quiet fade away.
Really?
And I don't...
A whimper?
Yeah, there's a lot of people in this town that have like renal insufficiency. That means a little bit of kidney problems and then all the way up to, chronic renal failure. And,
wow.
And I think a lot of them would be surprised they have it, actually.
Okay, all right. Well,
Super common and largely unrecognized. So that's what that means.
Is it just because it doesn't present itself, like you were saying, in dramatic fashion?
It's kind of vague.
Yeah.
And it's mostly, at least initially, incidentally found on labs. But it's typically caused by diabetes and hypertension, which are two local favorites.
Okay. Especially
out of control for both. And it's also a risk factor for heart disease. And I thought this actually was kind of interesting. But when we talk a little bit more about what kidneys actually do besides make pee, then, I could tell you what I think about that. But for lots of possible reasons, there's a gradual loss of nephrons. Nephrons are the filtration unit in the kidney. So right where the rubber hits the road.
Is this analogous to what do they call the little air sacs in the lungs?
Yeah, alveoli.
Yeah. They do all the work, all the heavy lifting.
And that for one reason or another, they become non-functional, and then the kidneys just don't work, and then finally there's a problem. Okay, but they do more than filter, and so an acronym that medical people remember is called a wet bed. Which I think is kind of funny.
A wet bed.
Yeah, kind of minor aside. Medical people remember this is like a labeled folder in their brain.
Okay.
And they pull it out, and then when they're thinking about why this person might have this problem, then a wet bed comes to mind.
Okay.
Because they learned it as students.
But what's a wet bed stand for?
So the first one is acid and base regulation. You know how some people drink vinegar and it's supposed to help their blood pH or something?
Right.
The body understands how to regulate pH. It doesn't need any help from
really?
us. That's not a real thing. But the organ that's maintaining it is mostly the kidneys and also the lungs.
I'll be darned.
Yeah. So who knew?
What's the human pH typically? Does it vary from individual?
Yeah, there's a variation of normal, but it's kind of around water, and that makes sense.
That does make sense, yeah.
Yeah. So the next one is water balance. So this is kind of tied to it, but actually some people first become aware that they have significant kidney disease because they have swelling because their water balance gets out of alignment.
So that's the old-fashioned water retention? Is that what we're talking about?
It can be retention, or it can be too much, or you can be too thirsty or not thirsty enough. This is super complicated, and I'm trying to keep this kind of like need to know.
Okay.
And the next one's electrolyte balance, and that's like sodium, phosphorus, calcium, and everybody's favorite potassium. And that's one of the things that I think relates to heart function, because what causes a heart to beat is electrolytes moving across a gradient, and potassium is one of them.
Wow, okay.
Yeah, super cool. So the next one is filtering toxins. So this is, we're kind of vaguely aware of this in Del Norte County. Everybody worries about taking Tylenol because they're worried about the effect on their kidneys, but Tylenol luckily is hepatically metabolized, so metabolized in the liver. Ibuprofen is the one that's metabolized in the kidneys.
Oh, see, yeah. I've never heard kidney concerns with any of those products. Just liver concerns.
And your favorite Toradol, actually. We have to be careful how we dose it in people that maybe have a little bit of insufficiency.
Okay.
So, because it's an anti-inflammatory, so those are metabolized by the kidneys. Regulation of blood pressure, and this is kind of a closed loop. Like if high blood pressure causes too much pressure to go through that filtration system and kind of slowly takes out those cells.
Oh, wow. And makes itself worse that way?
That's why and that's why the kidneys kind of have a self-interest in making sure blood pressure is normalized, right? And so they have a bunch of different mechanisms that they use to kind of keep the pressure within a safe boundary for those cells.
Right. Okay.
So yeah, that's kind of cool. The next one is erythropoietin, which I spelled wrong, but it's the hormone that stimulates red blood cell formation.
Okay.
So people with chronic kidney disease become anemic.
Okay. Yeah. All right.
Okay.
All right.
There are many causes of anemia. Everybody starts worrying about eating spinach, but that's for iron deficiency anemia, and there's like 12 other kinds of anemia.
Oh, wow.
So
All right,
kidney
all right.
disease is like one of the causes of anemia.
I know that for Lisa, my wife, like her iron intake and all of these things like phosphorus and the other things that you were mentioning, but and potassium especially, and iron, she has to be really careful about how much she actually takes in.
Right.
Well, okay.
Yeah.
That makes sense.
So erythropoietin is the hormone that stimulates the bone marrow to make more red blood cells, and it comes from the kidneys.
All right.
So that's kind of cool. And then vitamin D regulation, and that kind of helps downstream with bone formation and bone maintenance. So chronic renal failure is mostly found by accident, like I said. And by the time we find it, it's been a problem for a long time. And usually chronic kidney disease is defined specifically as the problem has been around for more than 3 months.
That's it, right?
Yeah.
Wow.
Yeah.
Okay.
So there's kind of gradations of kidney problems. The first one is like insufficiency. So, the kidneys are kind of leaning toward a problem, but maybe it's solvable. And you just have to like address it. And oftentimes that doesn't happen because insufficiency is like the patient's almost never even told about it.
Really?
Yeah.
How does that work? What do you mean?
Because, so it's like 6 o'clock or 7 o'clock at night, and somebody's tired. A lab comes in. The things that we use to measure kidney function is a little bit off. The provider who's really doing their job looks at what how does that compare to the past? And, does it correlate to anything that's known that might be a problem, like an onset of diabetes or something? And then, like, what do you do about it? And oftentimes it's like, oh, well, it hasn't really changed in 3 years. Click, moving on.
Okay, so that, yeah.
Yeah, and then it never really makes it to the problem list and never really makes it to the patient's attention. So with our recommendation that people advocate for themselves, this might be a way to advocate for oneself.
How would you know to even advocate in that
Well,
regard?
if you have blood drawn, say, is that almost always the two basic tests, measured kidney function among other things. Say, so what was my kidney function? Any concerns there? You can ask. You're allowed to talk about it. In my practice, I give people a copy of the results, and I go through almost anybody when you're looking at your own blood tests, it's a little trippy. And so anytime you see an H or an L, meaning a high or a low, or not within normal limits, then you're like, your mortality is right in your face.
Yeah, right. Yeah, that's
Even though it's like totally not a big deal 99% of the time. But just say, so, what should I be looking at to look at kidney function?
Okay.
And then, make a note of how it changes over time. Okay. So it's about 3 times increase in Hispanics and African Americans.
Wow.
But it has been ascertained that this is not for a genetic reason. This is
Seriously?
access to care issues.
Wow.
Yeah.
Oh my God.
Yeah.
Wow. So what? Just regular screening? Is that the kind of access to
Yeah,
care?
they don't get regular screening, and then it may be not taken seriously, or maybe not interfacing with the medical community enough to have continuity of care.
Right. Okay.
So, if there's probably a little bit of sin on everybody on this one. So, and that actually does affect our community because we have a lot of Hispanics. We also have a lot of diabetic population too. Symptoms of kidney failure are super non-specific. So this is, everybody comes in and says they're tired. Everybody's tired. And it's easy for a provider that's hearing that for the 15th time that day to maybe not
Yeah,
you
I'm
know,
tired too, right?
Yeah, not take the time to maybe do a couple computer clicks and look at what kidney function has been for this person. So oftentimes you can see an abnormality, at any particular, point in time, and then notice that it's really been there a while.
Wow, okay, yeah.
So that's what you should ask. Edema, which is swelling, okay, usually in the legs. Nausea or vomiting, which is like all of Del Norte right now because there's a stomach bug going through. Itching, restless legs. Okay, restless legs, my guess on that is anemia. So if you have a lower number of red blood cells or a lower number of oxygen carrying capacity, as soon as you put your legs up at night to go to bed, then the muscles start complaining that they don't have enough blood.
Oh, wow.
Yeah, and poor appetite. So all of those are kind of vague, and I don't know that I would jump all over kidney disease for for fatigue. I'd probably check somebody's thyroid first.
It's if these are the symptoms that you're presenting with, it could go. Yeah, it could go in a lot of different directions, right? I mean,
right.
Huh.
Yeah. So if you go in with some of these complaints, I oftentimes say to the patient, I think we should throw a wide net, which means I think we should look at a lot of different things in kind of not very in-depth evaluation, like screening. That's what screening is. And then kind of pick what we find and go from there. So it's easy to diagnose on routine labs. So the two labs you would look for used to be creatinine. Creatinine is a marker molecule, and it tells we look at the ability of what it is in the blood. So is it backing up in the bloodstream, or is it normal? And then the assumption is made the kidneys are able to filtrate it out. Okay, and it definitely goes up in somebody on dialysis might have 2 or 3 or 4, like really high creatinines. Mostly normal is, I think, 0.9 to like 1.1. Although I have seen some people with like 0.6 and 0.5. So really low values just means your kidneys are filtering really well.
Yeah.
So don't get upset. Sometimes low is good. And then, but what we've been looking at is something called, and this is going to be hard to say, but a glomerular filtration rate, so GFR. And it's different for different races. So people of color oftentimes have different different normal. Okay. But that's like more specifically, instead of looking at a backup in the blood, it's like what's happening at the level of the kidney. How is stuff crossing over? What's the ability to cross stuff over? And that actually has been a way more helpful tool, and that's just shown up probably the last 3 or 4 years.
Really? Wow.
Yeah.
Wow.
Yeah. So ask what your GFR is, because that's more important actually than creatinine, but ask for both.
Okay.
Okay. So treatment, of course, is dependent on the specifics. So what's causing? Maybe somebody's on chronic ibuprofen, and if they stopped it, they could get better.
Oh, wow. Okay.
Yeah.
Okay. Because once again, in a lot of the things that we discuss here in Health Matters, it's like here we've got chronic kidney disease. It could be a whole bunch of different things.
It could be a whole bunch of different things. So you really got to talk to your doctor about the specifics. And that doesn't mean that you should be afraid of ibuprofen. It's a great drug. It does wonderful things. Anti-inflammatories in general are really, really helpful. And like you're a believer with Toradol, but
just from what you've told me too, it seems like so much of what weighs people down, how these conditions and diseases affect people, and the real damage they do, it all comes through inflammation, or a lot of it comes through inflammation.
Totally. So there's a lot of important reasons to take it, but pay attention to dosing. You're not going to impress your provider if you're taking twice the recommended dose and it's not helping you. That's only going to put you in dialysis.
Oh, wow. Okay.
So we're like not impressed by the burden of your pain when you take your meds incorrectly. We'll just look at you and sigh.
No dying swan there.
No dying swan. Okay. And I'm sorry people are in pain. I'm in pain too. I don't want to make light of it. It's a terrible, horrible thing. But it's also better treated with accurate information.
Right.
Okay. So what should you do if you have chronic renal failure or even renal insufficiency? Well, if you're diabetic, you should keep your hemoglobin A1C below 7.
Okay.
So I would say that also for somebody with a diagnosis of pre-diabetes too. And a hemoglobin A1C is what your blood sugar has been on the average over about 6 weeks.
Okay.
Okay. And we do a lot of them since they've been used as a way to diagnose type 2 diabetes. People get screened all the time with them. I know at UHS, pretty much every adult every 4 months.
Wow. Okay. Okay.
Or 3 months. Keep your blood pressure at less than 140/90. Okay. So when people talk about going to the doctor's office and having white coat hypertension, and that's the only time their blood pressure is up, first of all, make sure you know that for sure and that you're measuring it at home before you say that. And second of all, it still causes damage. Even if it just goes up when you have a stressful situation.
Yeah, it's not a good thing.
It's
right,
still bad.
Yeah.
So don't blow that off, okay? Keep an eye on it. Actually, more like 110/70 would be more ideal, okay? Stop smoking. Yeah, so that's important. Keep your weight in a healthy range. So what they mean by that is a body mass index of less than 27.
Okay.
Okay. And this is the question you actually asked about, I guess, that Lisa asked about, is what dietary changes should you make? Kind of interesting because I didn't really find very many, and the ones that I'm going to go through I think are a little bit vague. So she asked a really important question because I don't ever remember counseling somebody with kidney disease about diet except a big, well, salt's bad.
Yeah. No, she has so many restrictions about, like I was talking about, like iron intake and things like that with her, that it's, the frustration for her comes from going online like we all do when you go online. And I try never to Google anything medical because you're going to find opposing. You're going to find opposing. Well,
you don't know the quality of your source. We learned that on COVID, right? Billy Bob's theory of the universe is not necessarily legitimate.
It just, she was looking for guidance to get to cut through all of those contradictions and gray spaces and actually get down to here's a healthy kidney diet as much as she could for her own experience. And thanks to the things that you've sent along, she's exploring that and has ways to move forward. But that's still an ongoing search.
Yeah, and I actually got that information that I sent you from the medical library up to date, which is expensive, and I only have access to it at my job site. So Joe Average Del Norte doesn't.
That's just, why not? Is it too confusing? Is it too technical? Is it there's no reason?
Some of it's hugely technical, but there's also patient handouts in there. How about if they could just let the patient handouts section be free?
There you go. Oh, that's part of it as well. And you can't, oh my gosh.
Right.
Yeah.
And it's called up to date because, the information that I sent along to her is probably no more than 3 months old.
Okay, good.
So
good.
That's super cool. But anyway, diet, modest decrease in protein. So that's different from, like, let's say somebody on keto is having high levels of protein that they're taking in. So this is recommending a modest decrease in protein. And the reason for that is when the protein byproducts break down, it's the kidney that's shoveling it, out into the eventually the sewer system.
So is it just a desire to not overtax the kidney with that? Okay.
Right.
Okay. And can you define modest?
See? That's why these are vague.
Yeah, okay.
Yes, in terms of grams, I didn't see anything that said grams, or I would be saying it.
Wow. Okay.
Yeah.
Okay.
That's
so I guess this is a matter of kind of hunting and pecking, but also, and Lisa's very good about this sort of going back regularly, and keeping her labs up to date and such. But you basically just kind of pick a number and try it, and then see what the next set of blood work tells you. Just for yourself,
I think she's going to have recommended grams per day in that up-to-date article.
Okay,
I bet that's in there. But a nutritionist or a dietitian would be a good resource for this. And are there any in the county?
I'm guessing not.
That I'm aware of.
Wow. That should be just a common part. Somebody should be a dietitian, nutritionist at Open Door. That should be like a staff position.
Well, they have one. And I don't even know if she's there anymore.
Wow.
It seems a little wobbly. So you should also keep your daily salt intake to less than 2 grams. And so when I mention this in the exam room, people immediately say, well, I don't salt my food. That's not what they're telling you to do.
You get salt
That's
in
a good
everything.
first step.
Yeah, yeah.
But you have to learn how to read labels. So if you look at a can of Campbell's, soup.
Oh God, yeah.
Oh
right.
my God!
Yeah.
First of all, you have to understand that a can of Campbell's soup is 2 servings at least.
Right.
Okay, and you're talking about 700 or 800, 900, milligrams of sodium in there in 1 serving. And so if you only get 2,000 milligrams for the day.
Yeah, that's half your day.
And you eat 2 servings.
And just for Americans, 2 grams is basically a teaspoon.
Yeah.
So that's that's not a lot of salt.
And then, so you also have to think about there's salt in cheese, for example. Who knew? There's salt in some kinds of candy.
Wow.
Salted caramel, or that's kind of obvious, but there's salt like when you make oatmeal. So
right, and you put a little salt in the water, and you've got exactly.
And if your mom's still cooking for you, there's a lot of salt, because that's how they learned to do it. But soup stock, which is going to be used in a lot of our Thanksgiving and Christmas seasonal foods, there's tons of salt in that.
And there also, though, for all of these things, there's lots of low sodium options out there too. Right up to and including soup stock and soups and things. So, but okay. That's a good thing to the 2 gram limit. And that's so keep keep salt intake less than 2 grams. I mean, how does that compare to what daily recommended salt intake?
Most people, if they salt their food, are probably up to 4 to 5, something like that.
Yikes! Wow.
Yeah.
Okay.
So double it.
I'm sorry. There's also but it was pop nutritionist basically who said, this is certainly applies for just like people who don't have kidney issues, but you can eat as much salt as you want so long as you drink enough water to metabolize it and to move it through and get it out. Is that true? And I have no idea how.
I think that's wishful thinking.
Is it?
Yeah. What if your kidneys aren't working very well?
Well,
your
no,
filtration system's not working.
Exactly. That's what I said. I think it applies to people who
you're relying on normal kidneys. You might not have them.
Yeah.
You might limit phosphorus by limiting processed food, and I actually think phosphorus might specifically be referencing soda.
Okay.
So
I have no idea how much phosphorus is around me in the food biome. I don't know. Is that listed? Is phosphorus on ingredients and on nutrition labels?
I don't think so.
No, you'd have to know what the phosphorus is in.
I think you'd have to again get some credible information and know what to be looking for. You might consider limiting calcium, but there's pluses and minuses to that. And then there's no change in potassium. So if the Mediterranean diet, and we've talked about it under the name DASH diet, dietary approaches to stop hypertension, is decreasing salt, but more importantly, increasing potassium. And so since that doesn't seem to be a problem with the kidneys, it would certainly help with blood pressure.
Lisa
that would solve a lot of these problems, Mediterranean diet.
And so is there any way that potassium might be a part of issues? Because Lisa is very much concerned about potassium levels for some reason, and I don't know right off the top of my head why.
People who are in advanced kidney failure oftentimes have electrolyte abnormalities, and one of them is they have high potassium.
Okay.
If your potassium gets too high, then your provider's head explodes because it really is an emergency.
Right, because that changes your heart.
And oftentimes it changes the way your heart beats.
Right.
And that can be, that can be all she wrote. That can be part of going down the drain. So
going down the drain.
She's concerned. I don't know about her degree of abnormality and whether potassium is a big deal for her or how that's tied to blood pressure for her. And, that's why I say it gets super complicated. Kidneys do way more than we think.
Right. And again, all of these, like with the potassium, they're almost like threads that you're pulling off of this very complicated sort of mosaic, and you're not going to really get an understanding from just that. You have to see the whole thing.
And kidneys have problems. I didn't really write this, but there's pre-renal problems. So problems that, like high blood pressure, that contribute to kidney problems. So the problem is actually upstream from the kidney.
Wow.
Then there's problems within the kidney, And there's also problems that like, for example, your favorite kidney stones that can completely obstruct a ureter, that's the outflow tract,
Right.
and have urine back up into the kidneys, and that kills the filtration units. So you can have a problem pre-renal, renal, or post-renal.
Wow.
So super complicated. So this led to something that I wanted to share that was a super cool thing, but unfortunately not accessible to you guys. But anybody who has partnership,
Right. I remember this. This is cool. This is cool.
is super cool. Get a piece of paper and a pencil, because this is worth writing down. So partnership pays for a meal delivery service of 2 meals a day for 12 weeks.
Wow.
And this particular, and they partner with a particular meal delivery service called Mom's Meals. Okay, and Mom's Meals, they have general meals targeted toward wellness non-specifically, but they have a lot of other options that are targeted toward helping people with disease issues.
Wow.
I've never seen this before. I was blown away. And that includes meals that target diabetics, vegetarians, people who require lower salt. They have renal-friendly diets, so that those are 2 separate diets that could be beneficial. Somebody who's pureed, which unfortunately is a problem here because of teeth. Pureed food, maybe that's part of keeping an elder in the household. Heart-friendly, gluten-free, and people who unfortunately have cancer, they have cancer support diets. But they also have nutritional counseling associated with it. And I'm thinking maybe this is how Del Norte gets nutritional counseling. So if you go to their website, which I think you're doing even as we speak.
I am right now. Mom's Meals, all one word, momsmeals.com.
Yeah, it looks friendly. I thought navigating the site was pretty easy. I don't think that somebody with partnership would randomly sign up for this yet, but I got a feeling it needs some input from your provider, because you're going to have to give them your partnership card or whatever.
So I'm sorry to interrupt. Go ahead. I'm sorry.
Sure. I think it might also solve the problem of food scarcity for some people, but only for 12 weeks. But maybe that's enough that somebody can get their feet on the ground.
Right?
Yeah.
If you have something that you get and you open the box and you look at it and you go, okay, I can get all this stuff here locally. Now I see how
Right.
it's arranged. I see
Right.
but looking, I mean, this is for serious. Like looking at the website, I mean, it dives right in with health plans and stuff for government and case managers, and this is not just here, buy this sorts of, this is a service.
No, they're very cleverly. So there's a lot of food delivery services right now, and they market mostly, I think, to younger people who are busy, maybe urban, that kind of stuff, who are trying to eat better, but it's just easier to stop on the way home from work and get a burrito, kind of people. But this is the first time I've ever seen it targeted to specific health conditions and paid for by not only partnership, but it looks like Medicare has some possible funding, and some HMOs, they said.
I'd like to see if my old out the box Obamacare can do anything with this stuff. That's really
I think
interesting.
it's worth checking, but if somebody doesn't have enough money for food,
right, you're not going to be able to afford this. But the
wait a
partnership
minute.
thing,
If partnerships pay, if you have partnership and you don't have enough money for food, I would investigate this.
and again, that's another thing looking at it that I don't see anywhere is a price. So
Right.
this is a medical service. I guess that's the way to think about it. It's a medical.
I think so too. And then, and it's 2 meals a day, and it's pretty straightforward. I suppose you have to have a home address to get it delivered, probably street address.
Momsmeals.com. Check that out. That's really interesting.
I know. And talk to your provider, because there was only one provider at Open Door. The nurse practitioner goes by the name Nora. Happened to mention it, and I was like, "What? This is a thing?" So,
all right, I'm gonna sign up now for updates. Actually, it says you can sign up, but I think just to sort of see, I don't think I'll get to anything in time for the rest of the show here. We're down to the last couple of minutes, but I was seeing if I could find anything like a price. But oh, here we go. Wow. Okay, so 10 meals, $80. 14 meals, $112. 21 meals for $167.
And that's probably, my guess is that's probably pretty comparable to the other meal services, but this one focus on health, and you can get your insurance to pay for it.
Lisa is visiting her family in Medford. She'll be home before dark today. I'm going to sit down with her, and we're going to dive into this and see what's offered.
That's what she asked for, specific nutritional counseling. And so even if you don't, you don't have one of the insurances that pay for it, it might be worth
the spending. Yeah. I mean, they're basically $8 a meal is how it's broken down
and
here.
These are portion controlled, okay? So you can't eat like the whole bag of chips. Really. So
everything and the bag.
Yeah, but I just thought it was super interesting.
That is. Oh,
yeah.
Well, we are out of time. Is there anything you'd like to add
No.
on this topic? Okay. Any insight about next week?
I'm still kind of working on UHS, maybe general informational, but everybody's busy. It's the time of year.
Yes, so. Yeah. Well, Lynn, thank you very much for throughout the week the links that you've sent over for Lisa to check out and steering us to Mom's Meals here and the information about kidneys. Everybody's got them. If you
pay more attention to them, they're hardworking.
They are hardworking and more important than you think, just in your day to day, walking around. All right, that's it for this week's Health Matters. We'll catch you next week. Thanks, Lynn.